is just an honor and a privilege to be in Jerusalem, Israel, with Dr. Uri Sonenfeld, who's the product manager of image navigation. And your product is DentSim Specialist.
We have two products, actually.
It's what?
We have two products.
Okay.
One is a simulator for dental education, which is the DentSim, which comes from dental simulator, DentSim. And the second product that we have is for implants placement. Navigated implant placement, which is called IGI. What I would like to present you is IGI.
Okay, so the other product, dental simulation, is that for dental school?
Absolutely, it's for dental education, bought by a lot of dental schools in the US since 1997, probably.
Okay.
For more than 20 years, we sell it in the US, and Jeff will present it later.
Okay, so you're presenting the other product, which is what?
Which is a GPS for dental implant placement. Just like a GPS. When you and me, I place implant, when we place implants, we need to drill into the bone. And you know, inside the bone, there's all these nerves and blood vessels and roots. It's a very crowded environment. And when you drill into the bone, you don't really see what's going inside, right? So you are kind of, oh, this is blind. You're kind of blind. And when you drill, you need to guess, are you exactly in between the roots? Are you close to the infraalveolar nerve? How far you are from the maxillary sinus, and so on. And you don't really see it, not in real time. This is where IGI comes into the picture. So,
now why would they want to use IGI when, wouldn't we want to just hire a robot to do the whole thing?
Do you have a robot? Actually, this is the next step. I guess any kind of surgery is some kind of navigation into the human body. You go into the body, you go into the abdomen, you're navigating. You want to find the appendix, you need to navigate. And just like you navigate with your car, we have application which we call Waze, which helps you to navigate. You have the same exactly technology to help you navigate into the maxillary bone or mandibular bone. And in order to do this, you need to have, first of all, a software which you can plan your case. Plan your case means you can select all kinds of implants, we call them virtual implants, and position them over the patient's CT. So every patient today needs to go a CT, a dental CT, which gives you the 3D of the anatomy of the patient. And once you have the CT, you can plan the case. You select the implants, I can show you. So we have a database of implants, and you can select them. And for this case, we need to select a pretty narrow, short implant. And then you can move it and position it on the bone in the right location and right angle to match the restoration tooth. So this is a simulation of the prosthetic part. We plan from what we call from the prosthetic to the implant. And once you have this plan, which you can see here also on the panoramic view, I can get rid of the lines here. So you position it also over the panoramic view. And once you have the plan, now you can go to the surgery, and then the technology, the system can guide you to drill the implant exactly the way you plan it. Because this is mainly the hard part. The hard part, everybody or almost every dentist can plan, can create a very nice planning. But when it comes to the execution of this plan, this is where the problem starts. You want the implant to be exactly in between the teeth, but actually when you drill it, you don't know if you're in between the roots. So the execution is the hard part, and this is where we come into the picture with our technology. I said it's like a GPS. For a GPS, you need to have a satellite. This is our satellite, which have two eyes, which create a 3D environment and a 3D tracking of every object here.
That is amazing. Now, how long has this been in the marketplace?
2002, I traveled to Florida, Boca Raton, and we installed the first system there.
For who?
For the name of the clinic?
The dentist.
Jeff Canales, who is a very high-end dentist. Jeff Canales from Boca Raton, Florida. We are good friends, and he was the first one to use the system in 2003. I think 2002 we installed, 2003 we trained him, and all this stuff in the clinic, and he was pretty much the first one to use IGI on real patients.
And so, what year was that you said?
Sorry, year 2002, 2003.
So now it's almost 2020,
Yeah.
and 2020 we're supposed to be seeing clearly in 2020.
Yep.
Get it? 2020 vision.
6.
So how many systems have you installed?
When we started in 2002, it was pretty rare to have a dentist which will scan his patients. CT scan was pretty rare. Dentists actually even had difficulties to read CT. We're talking about 20 years ago. So we were a little bit, how would you say, ahead of our time.
Mm-hmm.
And it took a while. I think it's only during the last couple of years that navigated implant placement becomes more and more popular. So
you're agnostic to the CBCT X-ray machine. You work with all,
absolutely,
and the same with the implant system,
absolutely,
and the same with the robot droid from Star Wars.
I'm not sure about that, but we tried.
Okay.
Yeah.
Try to speed up the droid part so I don't have to go to work.
Yeah, I'll do the same. Well, we're about the same age, so I think we both see retirement just around the corner. So yeah, robots can replace us. Until they do, this is pretty much robotic, except the fact that I'm doing the drilling. But this technology tells me what to do. I don't kind of need to think. It tells me exactly where to drill, when to stop. It can actually, and I will demonstrate, stop it for me when I'm doing any kind of deviation from my track. If I try to go too deep, it will stop me. It won't enable me to deviate from the original path.
So
it's foolproof.
So the sensor above is communicating with the handpiece.
The sensor above here can see my kind of antenna that I have on the drill. So this is my drill, and this is infrared LEDs that connected and can be seen by the camera.
That is just amazing.
And if you see, when I come close to the, and when I come into the line of sight of this sensor here, you can see on the screen my handpiece movement, the simulation of the hand. So every movement here can be tracked by the camera. When I move the drill, the camera can see me and track my movement.
That is amazing.
When you talk about navigation with cars, the satellite in the sky track the car. But there's only one moving object, which is the car. Let's say you want to go home in Phoenix, Arizona. Your home is not mobile. It's in the same place all the time, and there's only the car that goes home. So you need to track only one object. Here in dentistry, we have two moving objects. The second one, the first one is of course the drill, but the second one is the patient. Patients are not anesthetized, so they move a little bit. So you need to track the patient as well, and that's why we connected what we call a patient tracker to the patient job. So it's not only tracking the drill movements, it's also tracking the patient movement. So the patients can freely move during the surgery, because we are talking about very high accuracy of drilling. Very high, I'm talking about 0.5 millimeter accuracy, less than, actually 0.35 in average. 0.35, so we need to track every little movement of the patient. So this is what we call the patient tracker, infrared light tracked by the sensor here above. So once you have the ability to track the drill, the ability to track the patient, and you have your plan here. Now you can guide the dentist during the surgery. I'm going to just load for a second the original plan, which is this one. and I'm going to make it easier to see the drill inside the bone. So I make the implant kind of transparent.
So does this reduce the need for an implant surgical guide or complementary to it?
That's a very good question. I would say it's complementary. Probably the very, let's say, easy cases when you have, wide bone, everything is okay, the nerve is deep inside the bone, you might use a surgical guide. But as soon as it becomes more complex, or you're more, let's call it a digital dentist, and you don't want to just drill by the guide without thinking what you're doing, because the guide, you don't have a lot of influence. You cannot do a lot of changes. You just have the sleeve, and you drill through the knee. It's through the sleeve. Here you can play. Let's say you're using a guide, and you find clinically that you would like to move your implant 1 millimeter to the buccal. With a guide, you just can't do it. You're limited by the guide. Either you use it the way it is, or you throw it away and get a new one. Here, with a click of the mouse, you can drag the implants on the screen 1 millimeter buccally, and it immediately will guide you to the new location which you clinically want now. So the ability to make a lot of changes in real time, very easily, the ability to, in a way, it's a freehand drilling. You have nothing in the implant side. You don't have the guide that block your vision, that might be a problem with the vertical dimension. If, let's say, you're walking on a second molar and the mouth opening is limited, it's hard to climb over the guide and go into the sleeve. Here, the implant area is free. It's kind of free-hand drilling with the guidance of the computer. So some of the dentists, probably maybe beginners, will benefit from drill guides and will prefer drill guides. Others will like the IGI and all the tools and freedom that it gives them. So 2 products, drill guides, IGI. We have some dentists that have this product and told us that in some cases they use drill guides, in some cases they take the IGI and use the IGI. So depends. The way the technology guides you during the surgery is with 3 what we call indicators. If I want to guide you during the implant surgery, I need to guide you about the location of the drill. Once you guide the location of the drill, I need to guide you about the angle of the drill. And then when you start drilling, I need to guide you about the depth of your drilling. So 3 parameters: location, angulation, and depth. So these 3 windows here will show you the 3 parameters. As soon as I get into the line of sight of the sensor, of the camera, and close to the implant, they start showing. Now, you see now, what you have here is actually 2 crosses. This is 1, this is 2. When I move, they move with me. As long as I'm off my desired location and angulation, they will be red. I need to move my location, the location of the tip of the drill, and change the angulation of the drill to get both of them centered and green. And this is the depth guide. And here, the deeper I go, the guide will go with me until I get to 0, and then it becomes red, and it means that I'm drilled all the way inside. So let's show you how it works. I get a full pedal.
So is the goal of the game to hit the nerve?
Only if you have too much money and you want to get rid of it, so it's a nice way to get rid of a lot of money. We actually play some of the cases very, very close to the nerve, and I do have one customer that actually planned his implant lateral to the nerve.
Oh, wow.
Lateral to the nerve. I can show you a panoramic of this patient, and you see on the panoramic 3 implants kind of in the nerve. But if you see the CT, you see that actually they are on the buccal side of the nerve. But he's a little bit cowboy, he's a little bit crazy. I don't do things like this, but you can really get very close to the nerve, and you have the benefit of this system keeps you of not traumatize the nerve.
Who have been your majority early adopters? Is it more country specific? Is it more age? Is it more oral surgeons or periodontists? Is it who's been adopting this the fastest?
Yeah.
What countries?
It's a good question. Mainly we sold in the US.
US?
Mainly in the US. We have some in Europe, some in Australia. Usually the oral surgeons think they don't need navigation because, oral surgeons are like God. Everything they do is perfect. So they don't need it, but more and more now when we talk about restorative driven implants, they understand that placing the implants just inside the bone in the middle is not good enough. You need to take care of where the restoration is going to be. And since planning here is based on the restoration, top-down planning, more and more oral surgeons are also now interested in navigation. So in the past it was somewhere beginners, dentists that felt not safe enough to do it freehand and wanted to have the computer kind to guide them and help them to do accurate, safe implants. And now changing more to the experts. More and more experts are interested in
Who are the more and more experts? The
implantologists.
Is it implantologist?
Periodontists, oral surgeons.
Yeah, so back in the day, when I got out of school in 87, you got out in 95, the implants would come back pointing any which way, and the oral surgeon would say, well, that's where the bone was tough.
Exactly.
Dentists like to believe that it's crown down, that the final restoration determines where the implant's going to be placed.
Right.
And you agree with that?
I fully agree with that, but not only me, I think more and more oral surgeons now understand that if I, as a restorative dentist, will refer to you, which you are the oral surgeon, and I get the implant where the bone is, but it makes my life very hard to get it to my restoration, to my crown, it's not going to work. I, as a restorative dentist, will look for this oral surgeon that will give me the patient back with the implants right where I want them. So the implant is a tool for restoration and not vice versa.
And I think it's so obvious. Like oral surgeons will sit there and say, I can get it right 99% of the time. And I always stop and say, okay, I agree, but 1 out of every 100 being wrong, how many do you place a year? And he'll say 1,500. Right. And I'll say, do you really want to send 15 implants, non-restorable, back to your referring dentist?
Absolutely.
That's a showstopper.
Yeah.
So now this is called Dentistry Uncensored. Do you think oral surgeons are getting better at this, or do you think periodontists are ahead in this?
I saw in the past when we exhibited our product in all kinds of exhibitions all over the world, including the AO meetings, I would see more general practitioners coming to the booth and less oral surgeons. And now I see a change in the tendency of more and more periodontists and oral surgeons come and show interest in this product. So I believe it's changing now.
And also when I talk to periodontists and oral surgeons, usually they have about 20 referring general dentists, but about 5 of them are 80% of their business. So again, let's say you place 99% correctly. You don't want to send, and you do 1,500 a year, you don't want to send 1,500 back because 5 referring dentists are 80% of your business. And if you lose one of those dentists to a periodontist or someone else,
it was 20% of you.
Oh my goodness.
Absolutely.
So it's you said this is a game of 0.035 millimeters?
Absolutely.
Yeah, well, oral surgeons and periodontists, their business comes down to 5 referring dentists. So you can't deliver them a failure 1 out of 100 times.
Absolutely agree. And I think not only you and me understand it now, that more and more they get to understand this fact.
Yeah.
And I see them more and more interested in our system.
So then the $1 million question is price. What does this system cost?
$30,000, $30,000 US. That's the price. And you need to take into account that this is the initial price, and unlike surgical guide, which you need to pay, I think you pay about between $150 and $250 US in in the US for a guide, for surgical guide. Here, once you purchase the system, there's almost no other extra cost for this.
So there's no case cost, there's no supply sundry per.
It's about you have some parts that you need to use, which is single use for every patient, which cost about $20 or $30.
$20 to $30 single use?
Yeah.
Well, 30,000 dentistry, I mean, CBCT, my CBCT costs 100,000. My CAD CAM costs 140.
Right.
There's lasers that cost 130. So $30,000 is a pretty
Makes sense.
low price comparison.
30.
Yeah. And one lawsuit, one lawsuit could easily be $30,000.
Right. So if I go with you about this, just think that this technology will save you from one lawsuit because you didn't drill into a neighboring root or the nerve. That's enough.
Well, then Carl Misch used to say something very funny and true. He said, if a patient can't afford to have their implant case done right, then you should do it haphazard wrong, and then when it fails, their lawyer will have it done right somewhere else, and you'll get to pay for it.
Right.
And in implant dentistry, if you do 5 cases and one of them fails and you redo it for free, you did all 5 cases for free. So these big cases are big lawsuits. I mean, when you start doing $25,000 implant cases, they have to be done right. And if you're not going to do it right, stick to fillings and cleanings and x-rays, don't go into implantology. It's a serious game. And then the other thing that's why I'm here and I'm so interested is when you travel around the world, the only 2 areas in dentistry that are growing at double-digit rates are clear aligners and implantology. The routine dentistry, cleanings, fillings, exams, and x-rays, they're pretty much flat, growing 1.5%, 2.5%, 3% a year. But implants and clear aligners, double-digit growth. You're an expert in this for decades. Why do you think implants is growing around the world at double-digit rates? So what?
I think in the past, I remember my grandfather used to have 2 dentures, and it was routine. Like every old people will have dentures, and it was fine. But not anymore. Nobody is now willing to have dentures, and implant changed this situation totally. Now you don't need to have dentures. You can have implants. You don't have to have these plastic things inside your mouth. And everybody now wants to not have a denture, to have beautiful teeth, and implants, dental implants, change the game in this aspect. You can avoid dentures and you can have wonderful teeth sometimes in a day. So the more people understand this, the more people will go into implants. And by the way, I'm not sure you know, Israel is #1 if you compare from implant to population. Israel is #1 in the world. Most of the implants per population are done in Israel.
So what is that ratio? You have about almost 9 million people and 7,500 dentists?
Actually, almost 10 million people.
So 10 million people and 7,500 dentists?
How many dentists in Israel?
Yeah, 7,500.
The ratio is about 1 dentist to 750, which in the US, by the way, it's 1 to 2,000, I think.
Right.
Yes, something like this. So we have almost 3 times more dentists per population that you have in the US.
So does that mean it's difficult to make a living being a dentist in Israel?
Pretty crowded here, that's true.
Pretty crowded? Do you think that's one reason they like to, more likely to get into implants?
I think it's worldwide like this. No, more and more general practitioners go into implant dentistry to make more money. I think it becomes more, Gordon Christensen, he was here
2 weeks ago.
2 weeks ago when I was there, and he said it's harder to become a dentist and to have the same income and more dentists need to work more before they retired to get, to save the money. So I think it's already become hard to be a dentist, and probably it's just one of the reasons people go to dental implants, to place dental implants.
Well, and the other thing about clear aligners and implantology, I mean, I saw this in Cambodia, Thailand, Malaysia, where insurance schemes from the government and private sector, they set the prices on cleanings, exams, fillings, x-rays, whatever.
Mm-hmm.
And usually the price is set to where you'll break even or lose money. But they do not set the prices on clear aligners or implants.
Right.
So like I was in several dental offices in Cambodia where they said, okay, my government fee schedule clinic, I break even or lose money. But in my big base of 2,500 patients, I pull out one implant and one clear aligner case per week. And that's why I'm a totally successful dentist in Cambodia. So it's kind of the insurance base is just almost like your public health service base. But if you can upgrade one person a week to an implant for $1,500 or a clear aligner Invisalign case for $6,500, well, do that 50 times a year in each, and you're doing very well.
Yeah.
My bouncer is telling me, Raphael, are you telling me to quit talking and pause the tape?
I want to inform you that there's another device, equipment that is very interesting to see in the next room, and we should also see that.
So she's telling me enough of the first dentist, and now I got to talk to the second dentist?
But
Okay.
But
Any-
you missed the important part. You didn't
Okay.
see the drilling. I need
Okay.
to show the drilling.
Okay.
So that doesn't matter.
Okay, really quick.
Real quick.
So, as we said, look at me, I'm drilling while looking on the screen. Okay, I get instruction from the screen. So everything is on the screen. And I move the location position to get it center and green. I change the angle to get it center and green. And now I can start drilling and look also on the right indicator which show you the depth. So let's start drilling. The deeper I go, the line goes with me 5 millimeters away, correcting my angle, 2 millimeters away, up and red. And the drill, you can hear the noise, the drill stops automatically. It's not me. I can press the foot pedal as much as I want, it won't work. Only when I come out, get away from the red and get the green, only then it starts working again. So, no mistakes. No room for mistakes. I can't drill too deep. That's it. That's the name of the game.
Well, thank you very much for showing this game. It was just an honor to have this demonstration. How do dentists wanting more information or wanting this device, this technology in their office, what should they do next?
Contact me, contact the company, and we'll...
How would they do that?
Email, phone calls, whatever.
Okay,
Yeah.
what email, what phone call, what website?
You have my email, I think. It's Uri, URIS @imagenavigation.com.
Okay. Well, thank you very much.
Yeah, hyphen, minus in between image, hyphen navigation.
Oh, all right. Well, thank you so much for your time today.
Pleasure.
So now we're back with Dr. Jeffrey Port on the right. And by the way, your last name is Port. The most famous Port in dentistry is Ruth Port, who is married to George Port and who owns Port Laboratories in Sydney, Australia. Is that your mom, your grandmother, or your girlfriend?
No, but I was thought I was the most famous person.
But a shout out to Ruth Port. And so you're Jeffrey Port, and you guys met Uri earlier. So you're going to show us the DentSim.
Correct.
And this is a product that is used in dental schools?
Correct.
For how long?
Since 1999, I would say.
And I really hope this is the future of dental licensing exams, because in an examination, the most important fairness is that it's a standard exam. So when you have these poor dentists coming out of school or moving to another state or another country, and they go take their licensing exam and your patient doesn't show up, another patient shows up drunk and want to open their mouth, and then my patient is just perfectly behaved, that's not a very standardized test. And I think these board exams, when they have live patients, I mean, that violates standardization of examination so bad. It's almost like it's a racket. In fact, I think most of these board exams are just ways to extract money out of students and dentists moving. And so show us what your DentSim does.
Okay, DentSim works. I'm going to go back on this. Go to the main menu for a second. You have lessons, you have practices, you have assignments, you have testing. You have different areas of dentistry. You have operative dentistry, you have prosthetics, you have endo access, you have composites, you have bridge preparation, partial denture, seat. So you have different options here. We're just going to go into the old mounted one. And what it does is give you lessons, it gives you procedure information, background history. It gives you see the x-ray, and then you go into the clinic and you can actually see what you're supposed to do. Where you have the tooth, this is a preparation in this case that you're asked to do, and you can move it by itself, you can move it together with the raw tooth, and you'll see everything here, and then it evaluates for you. What happens is, well, let's go to the demonstration and we'll go over it. When you're drilling, let me get my glasses for this. When you're drilling, you're going to see it, the drill in this area, and you'll see the cutting over here in real time, without any delay. You'll see any kind of mistakes that you make, you have show up on runtime real errors, and then you can have evaluations. So, if we start, you obviously have to pick the right burr, otherwise you're going to get the wrong information. You see the drill moving, and there's no delay on it. If I cut into the tooth, I'm just doing 3 punch points, and I don't really look as far as where I'm doing it, because that's really not what I wanted to show.
So is it a specific to a handpiece, or is it a handpiece agnostic? Or when you get the DentSim, does it have its own specific handpiece?
It has a cable handpiece with these lead indicators.
It has a what?
With this, it's this setup, as you see, which has LEDs just like the IGI has, but it's set up differently. This way you can see it from all different angles. When you do implants, you're basically going in and out at one angle, whereas with dentistry, when you have crown preparations, you're moving your drill in all different angles, and because we have the LEDs all around it, the camera will pick it up, and it can show you everything.
But does it come with? It comes with the handpiece.
With a handpiece.
So it uses your handpiece,
It
not.
uses this handpiece. Yes.
Okay, so it's not agnostic to handpiece. It's a specific handpiece.
Specific handpiece.
Okay.
What I really wanted to show was if you go into the evaluation and you look at the, I'm just showing the residual carries here on purpose. Okay. I don't know if you can do that. I don't know if you can do this with the camera, but if you can look, can you see with that?
Yes.
Here? Onto the tooth. Is it showing you the tooth? I don't know.
Yes.
If you
Zoom in, can you
Zoom
zoom
in.
in? Yeah.
If you then compare this to the screen, you'll see how accurate we are.
Nice. Nice, nice, nice. And I'm talking about your mani-pedi. Okay.
Okay, let me put this away. There are many different parameters that are checked. Okay, you have outline shape, you have outline centralization. Every type of procedure has its own list of things to check. And obviously you're going to look for different things in crowns as you are going to check with fillings. And truth is, I would love to have this when I was in dentist.
And what do you think the advantage is of this than the way that you and I did it in school?
If you were a student in school and you had to wait online for the professor every time you wanted to have something checked.
That's true.
You wait, you lose time. You can also only check after it's done. Whereas here you can check as often as you want. It's having an instructor on your shoulder.
And was it just me? I mean, we call this Dentistry Uncensored. It seemed like whenever I'd raise my hand for a check, the instructors would always check the beautiful girls first and the bald guys last.
And also, if you take a tooth and go to the instructor, you will get one feedback. If you give the same tooth
Right.
to the beautiful girl beside you, and she will go with the same tooth, probably get a different feedback.
You know, that was the most stressful thing in dental school, that the dentist who signed you in for your clinic patient needed to be the one that signed you out, because the guy that signed you in would say something totally different than the guy that signed you out. And you learned in a day that you only want to work with one instructor per patient, because you were never going to get, if you had 3 different teachers look at the prep, you'd hear 3 different answers.
Absolutely. And even for the same teacher, if you had a rough night the night before, when he comes and sees you, suddenly everything is bad.
Yeah.
So we're talking about kind of objective, personal, real-time trainer. You always get the same feedback. Everybody gets the same feedback. It's in real time. It's objective, as you said before, and it's very accurate, and it gives you tools that you cannot see by yourself, because here you can see cross-sections. When I come with a plastic tooth to the teacher, he cannot show me cross-section of the tooth. He cannot zoom in and zoom out. He cannot show me he can't show me the dentin or the enamel. So there's so much more information that you can get on a screen compared to what you can get from your teacher.
So what are the main procedures? Fillings, crowns, endo access?
Yep.
Right. We have
What-
bridge on there,
Bridge?
and we have a rest stop for partial denture.
Rest stop for partial. So I'm sad to report this to you, but the largest partial denture lab is in Nogales, Arizona. They get about 1,100 partial a day. And then they put them in a car and they drive them across to Mexico, where they have the foundry that does that. And I've been down there several times, and out of 1,000 incoming cases a day, 900 just says lower partial. They didn't make a single preparation, no design. And I'm like, come on, guys. They're paying you $1,000 for a partial, and you couldn't get a football burr and make a single rest seat. What do you make of that? Do you think they don't know? They don't understand? Do you think it's lazy? What would you think of that?
All the above, huh?
Yeah, come on, guys. You ever watch ESPN football? They have that segment, come on, guys. And come on, guys. If someone gives you $1,000 for a partial and you can't even look at it long enough for a rest seat, why don't you give them a referral to someone who's a little more motivated and ambitious? I just, I find that embarrassing. So that is one of your features on this is cutting rest seats. Now, do you think you still need to survey for a lower partial, or am I giving away my age?
Well, this is an educational tool. This technology teaches the student how to work very accurate, very precise, The student that uses this technology will learn faster and be better, and we have research that show it. So this educational tool changed dental education from all the aspects we talk about. Objectivity, real time, preciseness, and so on and so on.
And if students are having trouble with particular movements or particular aspects of their preparations, they can work just on that.
And they can also work 24 hours a day, 7 days a week. They don't need a trainer, they don't need a teacher. They come to the dental lab, they open it, and they sit and train and train and train. You should see our R&D manager. She can make beautiful crowns just by, and she's not a dentist, just by using the system and playing with it, she can probably make better preparation than most of the dentists I know. Just by using it alone, it's an independence tool to improve the student.
Now, this company, Image Navigation, we talked earlier about your implant product. Do you see this merging with that? I mean, will this be implant training too for students someday?
Absolutely. When you see, if we talk about the evolution of the company started with this product. This is our first product. And we realized that we can give the student real-time feedback. So we said, wait a second, if we can give him real-time feedback, why can't we really guide him and show him what to do? And why don't we take the technology out of dental school, which is a niche, into the market, the full market, which we go into private practices and go into dental, implant dentistry. So suddenly we took a product which gives you feedback into a product that is for everybody that wants to place implant, and it can guide you and tell you what to do, and you can combine them and use the technology to train students how to place implants. So we have plastic models for implant dentistry, and they have the same IGI technology, and they can learn how to place implants correctly. So we have the product for restorative dentistry from one side, the product for implantologists from the other side, and combine them, product for dental students that want to practice implant dentistry.
So we talked about early adoption for your other product when you said it's mostly United States. Where is your most adoption for this product around the world today?
This one?
Mm-hmm.
Mainly the US. I think 400, how many systems you don't know? Yeah. Most of the system are all over dental schools in the US.
So you think it's about 400 systems? Or
No, much more. We just installed a few years ago 120 simulators in Thailand. In one school, 120. Bangkok, Mahidol University in Bangkok.
Nice.
120 simulators in one dental school.
So the United States has 56 dental schools or 58?
United States, wow, I'm not sure.
How many dental schools are you in?
You tell me how many dental schools.
Yeah, it's 56. How many dental schools are you in the United States right now, would you guess? Out of 56.
You know, we are R&D people. Marketing is not. You should ask Lauren about this. You will know.
Yeah. And what is the price of this system?
I think it's about the same. No, it's again marketing. Yeah.
So you don't know what it costs?
We're bad in marketing.
But it seems like more than one student could use one system, right? I mean, you wouldn't need a system for every student.
Sure, you have different students can go in.
So really, technically, you could have almost one system for one school if you used it around the clock.
Doing our marketing, but usually we have the number of 1 to 4, ratio of 1 to 4.
Per
you
student.
Want all of them, per student, if you want all of them to benefit from the system.
Yeah.
Otherwise, they will stand in a line to work with the simulator.
You can have different instructors and as many students.
And what has the feedback been from the dental schools that used it? What is the clinic instructors and the deans thought after using this technology?
In the beginning, the clinical instructor had kind of a problem with our system because they said, oh, maybe this technology will replace the teacher because this is a personal digital teacher, so it can maybe replace you. So at the beginning, they had problem with this, but they soon understood that this is a teaching aiding tool or a supporting tool for them. they would love it because they can show the student everything. Because sometimes, you go to the teacher and try to explain you what's your problem, and you see that the student doesn't really understand. But with this tool, you can show them exactly what's the angle of the wall in this cross section, how deep you are. We have the depth of the cavity. You can see with kind of a geographical map with different colors, so you can understand really easily. So this is a wonderful helping tool for the teacher itself, and the students love it. They really love it because they don't need to wait in the line. They get the feedback. They can work independently. It's great for the student, great for the teacher as well.
So what are your biggest challenges getting this into a school, and why did the Thailand school get these? What are your biggest challenges?
I think in a way it's such a breakthrough in technology, and dentists, as I said before, I think they are a little bit technophobic or old school or what else, So it's hard for them to change from a way of teaching dentistry for the last couple of 70 years probably with the plastic tooth and drilling, sudden change to this. It's a big shift, so I think this is probably the biggest challenge. It's really,
the next generation is amazing. I had my granddaughter on my lap the other day, and she saw me on my iPhone, so she jumped on my lap and she says, "Play me Rudolph the Red-Nosed Reindeer." So I Googled it on YouTube, and I pulled up Rudolph the Red-Nosed Reindeer, and out of nowhere, she takes her finger from the bottom of the screen, flips it up. There's a bunch of videos, starts spinning through, and says, "No, not that one, this one." And I'm like, I didn't even know that was a feature. Yeah. She's 3 years old, and she just taught a 57-year-old grandpa how to use YouTube. And I thought, how did she know how to do that? And it's just, so it's, the technophobia is a sign of your age, right? All right, well, is there anything else you wanted to say?
Probably so, everything we have, yeah.
And what would you say to a dental school dean who's sitting on the fence about this new technology?
If you wait too long, other school will purchase this technology, and then student will go to learn in the other school because they have state-of-the-art technology, and just drilling a plastic tooth and go to the instruction, it's old school.
And is that usually the purchasing decision made by the dean? Is that usually it's the dean? Well, five of the 56 dental school deans went to dental school in Jerusalem or Tel Aviv, so you should at least get those 5. Okay, so which dental schools did you go to?
I went to Columbia University.
Columbia and?
Here in Israel, Jerusalem, Hadassah.
So which dental school in Israel is better, Jerusalem or Tel Aviv?
That's a politically correct.
Do either of those two?
Both are really good.
Do either of those dental schools use this technology?
Yeah, they use this technology, both of them. We sold them many years ago. And we wait for another dental school to be open in Israel so we can have...
Yeah, they're going to build a third, right? They're talking about it.
I'm not sure about that. They're talking about it, I'm not sure.
And where would the third be?
We don't know.
You don't know?
No.
That seems to be the new trend around the world. I remember I was in Malaysia and Cambodia, and in Malaysia, 10 years ago, they had 1 dental school, and now they have 11.
Wow.
And you went to Columbia, which is in Manhattan with NYU, and they have the SUNY dental school in Buffalo, and now they're building, they opened up another dental school. So dental school expansion on the rise. When I got out of school, it was a wave of closing down dental schools. They were closing down Emory, Georgetown, Farley Dickerson, Illinois. I mean, they when I got out of school, that first 10 years, they closed down 7 schools. And now in the last 10 years, they've reopened up 7 dental schools. So dentistry is definitely on an expansion. The world has 2 million dentists now. And so as these dental schools are expanding, they'll probably go high tech. So congratulations to all you do. And thank you so much for spending all this time with me on my visit to your company.
Thank you for coming here.
All right. Have a great day.
Thank you.